I'm Riley Cox, Flinders Sport and Fitness Physiotherapist. I'm here today to talk to you about the all too common aches and pains that occur from spending too much time on your phone and too much time on your laptop and too much time at your desk. I'm going to cover how they happen, how to avoid them, and how to fix them. How it happens. Not moving enough or staying in the same position for too long. Even a good position can be a bad one if you stay in it for a prolonged period of time. Sitting at your desk with rounded shoulders and a forward head posture can lead to shortening of the muscles at the back of the neck as well as compression of your cervical vertebrae. Gazing downwards for too long is another no-no. Whether it's on your phone, reading a book, or using your laptop, in this position your head is surprisingly heavy to hold, which puts a lot of strain on your neck and upper back muscles. Wrist, elbow and finger pain is common amongst desk workers. Bending your wrists inwards or outwards can cause pain while typing. Similarly, holding your wrists in extension puts a lot of strain on the muscles attaching further up the arm at the elbow. Tucking your feet underneath the chair or stretching your legs out in front of you can put extra pressure on your lower back. Tucking your feet is normally coupled with leaning too far forward, and stretching your legs out is normally coupled with leaning too far back. Both of these positions can put unnecessary strain on muscles that are not designed to support in these positions for long periods of time. How to avoid it. Improve your sitting position by making sure your feet are flat on the ground with your shins perpendicular to the floor. Ensure your knees and hips are forming right angles and that your hips are all the way towards the back of the chair so that your spine is resting nicely on the backrest. Avoid gazing downwards for too long and putting strain on your upper back muscles by holding any handheld devices directly in front of your eyes rather than down at your waist. If you are looking at the computer screen, raise your desk so that you can keep your head and spine in a neutral position. If your desk is not adjustable, use books to elevate the screen. When using a keyboard, keep your arms parallel and your wrists in a neutral position. This helps to reduce strain on the top and bottom of the wrists and in the fingers, as well as reducing the strain on the outside of the elbow. You can try putting a small mat in front of the keyboard to help keep your wrist in a neutral position. Do not elevate your keyboard. Despite all those tips I mentioned being helpful, the number one way to avoid aches and pains of working at a desk is to move. Get up and have a stretch every 30 minutes and change your positions regularly. Lastly, I'm going to show you some specific stretches and exercises you can do at your desk or in your office to fix and prevent these common aches and pains. Seated spinal rotation. While seated, cross your arms over your chest. Grab your shoulders, rotate your upper body from the waist, turning gently from left to right as far as feels comfortable. Thoracic extensions. With your hands clasped behind your head, lean backwards over the backrest of the chair, forcing your upper back into extension. Seated glute stretch. Cross your legs so that your ankle is sitting on your opposite knee. To increase the stretch on your outer hip, lean forwards and push down with the hand that is on your knee. Shoulder shrugs. Gently pull your shoulders up towards your ears as you take a deep breath in. When you get to the top, release the air in your mouth and drop your shoulders. Standing hip flexor stretch. With your front foot placed on the chair, slowly lunge towards the chair so that you feel a stretch in the front of your opposite hip. To increase the stretch, put your arms up in the air. Shoulder flexion and thoracic extension. Holding on to the back of the chair, push your head towards the ground and keep your arms elevated. Standing hamstring stretch. Place your heel on the chair and flex at your hips to feel a stretch in your posterior thigh. Assisted wrist flexion and extension. Using your opposite hand, pull your wrist into flexion and extension. Seated shoulder stretch. Hold both your arms above your head. Link your hands with your palms facing upwards. Reach as high as possible. Standing calf stretch. Standing behind your chair, Extend one leg out towards the back, keeping your leg straight, press your heel towards the ground. Neck rotations. Keep your head upright. Gently turn your head from side to side. As you turn your head, try to move it past your shoulder. Neck flexion and extension. Look up at the ceiling and then bring your head forwards so that your chin is on your chest. For the static stretches, hold for 15 to 30 seconds. For the dynamic movements, do 10 reps and complete 2 to 3 rounds of each. Do this a couple of times a day. Thank you for watching. These are just some generic exercises that you can do on your own on a daily basis to help you with your pain. If you are experiencing pain, I highly recommend seeing a physiotherapist for further education, manual therapy and corrective strength exercises.